In this discussion, we are trying to understand the final details of the cat castration. Now, we all know that we are doing a scrotal castration and we are not using suture materials in a cat castrate. But let me show you some of the final details that I learned in London. Okay, and so if these are the testicles over here, you have to make your incisions parallel. Okay, parallel to the testicle. I mean to say parallel to the scrotum. Okay. So, and you have to stay at least a few millimeters away from the like the median raphe. So the first incision is over the testicle, but the length of the incision is at least the width of the testicle. That would be the first skin incision. The second incision you would be doing over the tunic, but you will be doing it in a cruciate manner. So the first incision went like this, second incision goes like this, the testicle comes out. This is the tunica vaginalis. This has to be disconnected from this end of the testicle, and then when you have the ductus deferens and the spermatic artery, the ductus has to be carefully separated from here. Then you can have the testicle in your dominant hand, and we can go for 3 pair of square knots, that is at least 6 throws. Okay, and then the testicle can be cut. This knot has to be put in the tunic first. This tunic has to be put in the scrotal incision, and then the incision has to be brought to a position, and the same procedure has to be repeated on the other side. Now the good thing about this is every time when the cat sits, because your incisions were parallel to the median raphe, and every time when the cat sits, it actually brings in a position rather than opening, because we all know that we have to let it heal by second intention. We're not using sutures, and though technically cat castration seems to be a very normal and very simple procedure, but if you take these kind of precautions, then you will not have complications. Of course, the sepsis has to be better, the pain medication has to be better, but this technique I've learned from Dr. Ursula, who is like an elder professional sister to me, and I've learned it from London, and I'm very grateful. This was told to me on a piece of paper, but I will always be grateful for her, because this one technique helped me operate hundreds and hundreds of cats, and I'm passing this information to even more so that they are able to do it better. Thank you so much.